The patients who come to our consultation usually want their teeth to be nicely set up straight. They want to have a nicer smile. But here, I first want to explain something about your health benefits that you have if your teeth are not crowded, not rotated, or not tilted. So, how do teeth stand in the bone? The patients who come to our consultation usually do not know much about that. Their main concern is, first of all, they want their teeth to be nicely set up straight. They want to have a nicer smile. But here I first want to explain something about the health benefits that you have if your teeth are not crowded, not rotated, or not standing in a wrong axial inclination. And that is what this chapter is about. For me, or for anyone of us in orthodontics, the main aspect is that the tooth roots are well and evenly positioned in the jawbone. The patients who come to our consultation tend to reduce their teeth to their crowns, which you usually only see, and they want their teeth to be nicely aligned and straightened, maybe like here in this picture, where you also only see the crowns. With your teeth so well and properly in alignment, well, with these teeth, you can really smile nicely. That certainly plays a major role, and if you look around on the home pages of most orthodontists and dentists, there the topic smile dominates the messages. This is also important to me, and there will be a special video dedicated to the aesthetic aspects of our teeth. But first of all, however, we should talk about the biological aspects. Then you will understand the health benefits that you will have when your teeth are not crowded, rotated, or tilted. I think this is important, that the teeth are well positioned in their bone, which means that they are surrounded by an even amount of bone. We can take a look at my study skull to see how much bone there is between the roots. As you can see, here the teeth are nicely lined up, one behind the other, and there's an even amount of bone between the roots. Teeth are not as firmly anchored in bone as if they were cast in concrete. On the contrary, teeth can move for a lifetime. Why this is the case, I will explain in a separate video. Here we first of all want to notice that the teeth are moving more and more into a crowded position. And it is probably clear to each of you that there is less and less space and bone between the teeth when they stand closer together. You can see the crooked or twisted crowns here. But we also look at the roots, and when the roots get closer and closer together, there is just not enough space for a decent amount of bone in between them. And if the teeth are evenly distributed in the bone, then an equal amount of bone is distributed between all the tooth roots, and as a result, the tooth crowns are evenly lined up. Most patients find this nicer, but this is a side effect and also of these evenly lined up roots in the bone. And why is that important? Well, unfortunately, there is always a breakdown of bone in old age. So far, nobody has been able to really stop that sustainably. If, however, there's a very little bone only between two particularly closely neighbored tooth roots, then there will be an accelerated vertical bone resorption when the overall bone level drops. Ice also melts particularly quickly at its thinnest part, doesn't it? So our goal is to give the teeth an equal amount of bone around the tooth roots. And this is an investment for the future. If we don't do anything, it goes on, and the teeth are less and less covered by bone, and one day the affected tooth may fall out. That used to be the case often in the past. People, including the dentists, were helpless and blamed the periodontal disease, and then were looking forward to the third set of teeth. Those of you who don't know what it is, that is how they called the full dentures, the prostheses. My grandma already had one when she was younger than I am today. That is the reason why I did stop the migration of the teeth for this patient. And we have shaped the dental arch in such a way that all the teeth had a chance to receive an equal amount of bone around their roots. In doing so, also the tooth crowns were well aligned, to the delight of the patient. We maintain this result with a little retention wire. And why this is so important, I will also explain in a separate contribution. But I'm concerned about a further problem. Since we have been examining more and more patients with modern 3D cone beam radiographic technology, we see more and more issues that we were not aware of a few years ago. In almost a third of our young patients, the teeth are not completely surrounded by bone towards the outside. The roots have only a very thin or not even any bone covering. And this picture is a computer-processed image, but if you don't believe it, I can show you a better one. This anatomical skull here. Very thin bone, or even no bone above the root. And therefore, you have to pay close attention to what you're doing when planning the treatment. If the teeth are crowded like this, then you cannot just simply expand the dental arch on all sides. In this image, it becomes more clear again. So if you do that, if you simply enlarge the radius of the dental arch, then the teeth and their roots move even further out of their supporting bone. So our goal is to preserve the teeth for a long term, which also means that we have to make sure that the roots are well placed in the bone, first of all. We will then rather resolve the crowding problem by moving some teeth backwards, or we will come up with some other solutions. In no case, however, will we simply expand the dental arches in an uncontrolled manner. Then the patient would have a nice smile at first, but that won't last long if the tooth roots stick out of the bone. Then the gums will soon recede with all the further negative consequences for the patient. And there's another reason why orthodontics is so important. Here we see a scientifically correct alignment of all our teeth in a computer-generated image in a view that you certainly have never seen before, from above and from behind. There is a branch of science that deals with the ideal position of the teeth in relation to one another. It's called gnathology, the theory of occlusion, which means the theory of the biomechanically correct alignment of the teeth. It deals with the position of each individual tooth in the dental arch so that the structures of our chewing organ are physiologically correctly positioned and do not create any damage. And when we see a patient with the teeth positioned like here, you will certainly notice signs of damage if you have a closer look. The gums are clearly far retracted at some teeth, and the teeth are well brushed, so inflammation should not be the cause. The teeth are not aligned properly. A crossbite in the molar area is noticeable in the back, and the bicuspids in the upper jaw are also in collision with those of the lower jaw, and there's an edge-to-edge bite in the incisor region. And here, not only the hard enamel has already been ground off, but also the gums are retreating. We know that the teeth are attached to their bony socket with delicate supporting fibers. In this sketch I have depicted them as these fine red lines, and in the tissue section on the left-hand side you can see, under the microscopic magnification, the fibers stained pink. And in the electron microscopic image on the right side, it becomes clear how thin and delicate they really are. So, in any case, we know that if we overload them, they will tear apart. And when these fibers are lost, the bone into which they radiate actually will also become reduced because it receives no functional stimulus. And if then the bone is missing, the gums recede because they do no longer have any underlying support. So it is our goal here again to align the teeth in such a way that they are evenly loaded when used for chewing, or when you just bite together when you don't chew, but when you simply bite together over the day. And you do that frequently. And here is an example, a treatment with aligners and with elastics. And at the end of the treatment, the dental arches are formed properly. The teeth can adopt a physiological position in relation to each other, which also loads the holding fibers correctly, but not too much. And after the dentist has rebuilt some incisal edges which were ground off with composite, each individual tooth will work properly. And finally, the patient can then also show a beautiful smile. We were also able to achieve that for him as a side effect. Well, teeth are not necessarily important for our survival. 50 years ago, when orthodontics did not exist with the high standard that we have around the world today, patients had lost their teeth earlier, not only due to caries, but also due to malalignment of the teeth. And general dental care has become better. The efforts of all dentists and better prophylactic measures have resulted in today's patients having less gingivitis or periodontitis and less or no tooth decay. And for these reasons, we can now keep our teeth for a lifetime. It is no longer a typical fate that they get lost, as it was the case in earlier times. But we have to align them to one another in a physiological correct way in good time, so that malalignment does not lead to incorrect lows and that there is enough supporting bone around the roots. And that is why orthodontics is important. And then you can smile nicely with nicely aligned teeth for a lifetime.